And now Dr. Timothy Williamson from the Ostroff Lab in Psychiatry and Behavioral Sciences is going to tell us a tale about sticks and stones. Do words hurt us too?
On any given day here in Manhattan, there are more than 26 billion words spoken. As children, many of us may have heard the phrase, "Sticks and stones may break my bones, but words will never hurt me." But are these billions of words really all so harmless? I'm not so sure. And neither are the lung cancer patients who have shared their stories with me. As a clinical psychologist, I have heard the emotional pain that patients often experience when talking about their lung cancer, particularly when asked this inevitable question: did you smoke? When asked this question, many patients feel blamed for their disease, and others feel like that question carries a lot of assumptions. And although smoking is the leading preventable cause of lung cancer and should not be minimized, this connection and the lack of public understanding about addiction has caused the harmful perception that lung cancer patients are somehow deserving of this devastating disease. This is called lung cancer stigma. And in my research, I found that, unfortunately, most lung cancer patients experience stigma in their day-to-day lives, whether or not they have a history of smoking. Which led me to wonder, what are the consequences of this stigma for patients' health? To answer this question, I designed a study and tracked a cohort of lung cancer patients while they were receiving active medical treatment. I found that when patients experienced higher levels of stigma, they had significantly worsening depression and anxiety, physical symptoms like shortness of breath, and sleep problems. Importantly, stigma was a more powerful predictor of these declining health outcomes than patients' age, gender, smoking history, the stage of their cancer, or even their medical treatment. This research shows that lung cancer stigma is a serious issue that can add to the burden of disease. So what we need are solutions that not only fix the problem stigma creates, but also ones that stop it at the source. In our lab, for example, we've developed a psychotherapy program that helps lung cancer patients navigate the painful feelings caused by stigma. We've also designed a specialized communication skills training program for medical professionals that teaches them how to ask smoking-related questions in such a way that doesn't make lung cancer patients feel blamed or defensive. What we say and what we do matters for health, which is why I'm on a mission to develop even more solutions that reduce stigma and improve health for those that need it most. Because we know that sticks and stones can break our bones. But it turns out, words hurt too. And I believe if we can change "what were you thinking?" and "how could you have done this?" into "what do you need?" and "how can I help?" we can transform words that hurt into words that heal. Thank you.